This morning.
Quitting smoking can be difficult, but there are healthy ways to do it. Joining us now with some tips, Dr. Thomas Luff from Unity Point Health Methodist. Thanks for coming in.
Oh, thanks for having me.
Now, I'm sure as a doctor you've seen the effects that smoking has on the body, and I think most of us know what that is. Why exactly are cigarettes so addictive?
Well, I have an interesting story on that. So cigarette companies have actually made them more addictive in a lot of ways. So there were FDA inspectors that came into Philip Morris, and they saw ammonia being pumped into the tobacco areas where they dry them. And one of the inspectors said, well, why is that? And they were told, well, that's a flavorant. And he thought that was really weird that they used ammonia to flavor tobacco, and did research on it. What they found was that actually the ammonia is used to make the tobacco or nicotine more addictive. It gets into the brain quicker. Mm-hmm. It becomes actually a need in some ways.
Sure. What are some of the best ways if someone wants to quit smoking? Give us some tips on how to do that.
Yeah, so there are several ways. I think the most simple way is quitting cold turkey. Unfortunately, cold turkey has the lowest success rates long term, so it's around 2%. Then there's nicotine replacement, and that comes in a patch, gum, an inhaler, various ways to do that. That increases the odds up to maybe 5 to 10%. And then there are two prescription drugs on the market, one called bupropion, or Wellbutrin is another name for it. That increases the odds to about 20% long-term success. And then the last medication is called Chantix, and that medicine has the best success rates. It is around 30% long-term success.
Any other ways that are better than those you just listed?
Yeah, not necessarily. So there are other ways that haven't necessarily been studied, hypnosis and things like that. But the success rates, again, haven't been well studied, so it's hard to measure. Probably somewhere in between many of those rates that I mentioned.
Okay. A lot of people worry that if they quit smoking, they're going to replace it with another bad habit like eating too much. Any concerns about that, or is eating too much still better than smoking? Well,
so it's still better than smoking, and it is true. Most people will gain weight after quitting smoking, but if you look a year to 2 years later, that weight loss or that weight gain has then been lost, and they go back to where they were prior to smoking.
And I've heard too that when you quit smoking, eventually, I mean, your body starts to get better. Is that right?
Absolutely true. So within 15 years, your risk for lung cancer goes down to a non-smoker. And within 10 years, your risk of heart disease goes down to a non-smoker.
Okay. What do you tell smokers when you encounter them about why they should quit?
Well, so I first I'll ask them what's their number one reason, and most times they say, well, I want to be around for my children. Smokers die on average 10 years sooner than non-smokers. Mm-hmm. So they typically say answers like their family, loved ones.
Sure. Does the hospital offer any smoking cessation programs or anything like that?
They do, and through any clinic at Unity Point, our primary care providers are able to help people quit smoking.
Okay. Well, there are some tips for you, and we're going to post all this information on our website, ciproud.com. Doctor, thank you very much.
Thank you.
Appreciate it.